I'm repeating myself after many, many episodes on this podcast. The best way, the easiest way to make the chronic inflammation in any joint decrease is unloading the joint. If you have a bad knee, the best way to unload the joint is with crutches. If you have tennis elbow, the best way to unload that joint and get the chronic inflammation on the way down is with a sling. And these are accepted, well-documented treatments for damage to joints that avoid surgery and injections in the joint. And they're very effective and used frequently by orthopedic surgeons. But orthopedic surgeons do not treat the temporomandibular joint, unfortunately. If they had kept the treatment of the temporomandibular joint in their own area of expertise, this problem of TMD would have been solved decades ago. Because whether or not they know anything about teeth or oral orthotics or oral quote unquote splints, they would have figured out, well, somehow we need to figure out how to unload this joint. And the best way to unload the joint is through a device that separates the posterior teeth, which provide 90% of the loads on the joint. So if you have a device in your mouth that effectively separates the posterior teeth, relieving 90% of the loads on the joint, it will allow the inflammation to die down. And then the question is how you're going to use that device so it doesn't create any unintended consequences like posterior supereruption of the teeth. So the protocol has been worked out where it is used 24/7 in adults for 2 months, which does not allow for a supereruption of posterior teeth, and then nighttime only the rest of the patient's life. And that has been worked out as being the ideal protocol to use a device that separates the posterior teeth, that is comfortable for the patient and is effective in long-term relief of the symptoms of headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, and various kinds of locking. We call that device that is patented, FDA-cleared, university tested to a high degree of validating our success rates in the 85 to 95% rate, the Urbanek Device and protocol.
Ask your dentist if they are a TMJ services provider.